Okay, this is Mark Sehl, and we're on our second interview with Dr. Gerald Lucas. I'm pleased to be here with him today. Last time we had a very interesting interview, and this is going to be a continuation of that interview, and this is for my channel, Therapy for the Heart, on YouTube.
Good.
Dr. Lucas.
Thank you for inviting me.
Last time, one of the things that you mentioned which struck my interest was you said that on occasion you take gifts from some of your patients. How would you determine whether or not you're going to take a gift from a patient or not? What would go into your thinking about that?
Well, in general, if it seems as though they had planned it well ahead of time, thought about it, and then they brought it to me, I'd be always appreciative of any gift that they want to give me, and I probably will enjoy having it. This thing that's in front of the fireplace, that was a gift, a monitor that connects this room with his room in his office as well, and he gave that and let me keep it. I don't like to embarrass anybody by not taking a gift. Of course, if a person gives me a gift with some ulterior motive and I anticipate it, I try to avoid that. For example, I had on one occasion a woman try to give me a gift by giving me a spontaneous hug before I knew what was happening. And I didn't find that I might have accepted it if I knew that the person was giving me a welcoming or responding to the fact that I'd welcomed her in here as a gift. But if a person gives me a too big a gift, that's embarrassing to me. I'd rather have a gift that fits my actual modesty. I may not be modest in every way, but getting a gift that is overwhelming is beyond me. But
you were overwhelmed by that hug?
Huh?
You were overwhelmed by that hug, or just not prepared for it? And you
if the person gives me too vigorous a hug, and everything depends upon who the other person is, and there's no question about it, and what our relationship has been. Mm-hmm. If it's been a long-term relationship, that's much different than somebody comes in pretty nearly second or third or 10th time, rather than frequent, a frequent thing that she thought about over a long period of time with me. Then I would much more readily accept any gift.
What would you say the primary focus you have in working with a person that's beginning treatment with you?
Well, if a person is a new patient, becomes a new patient of mine, I try to be as comfortable with them as they could tolerate. And if they have some difficulty, for example, some people can't lie down on the couch in the first session or the second session or the fifth session, I ask them what is their objection to it first, and then if they can't explain it very well, I help them, see if I can help them with their problem of explaining it. And if not, I help them just to be comfortable sitting up and either facing away from me or facing me directly. And I find that helps them to converse with me more directly, and also with a little more acceptance of that they may say something a little more personal than they were prepared to do it otherwise.
With somebody who has a difficulty talking, for instance, which some patients do, how would you how would you approach
that? A person has difficulty talking to me?
Mm-hmm.
Well, I ask them, first of all, I ask them, usually if a person is brand new, I will ask them, could you tell me something about your parents? Your father, your mother, brother or sister or something like that, and I get them to talk about that. And that is just becomes conversational almost. And they don't have to tell any secrets about their mother and father or brother or sister or some other member of their family. They don't have to do that. They just talk in a way that shows that I'm interested in knowing a lot about them bit by bit. That isn't too personal at the first meeting. So that goes along fine. I've had that occasion. The thought occurred to me just now to wonder about where I got that habit from. And it may have been that I got it from myself or my mother when I was a child, or it may have come to me from Dr. Spotnitz, Hyman Spotnitz, who taught me an awful lot about being comfortable with patients and having them to be comfortable with me. But actually, I remember now that after being in school with him for one semester, I became much more comfortable than I would have been without that one semester with him. That really helped me in my first semester teaching at the new school that was built around him and for him. I was very comfortable working with brand new students and people who I didn't, some of whom I knew and most of whom I didn't know.
Dr. Spotnitz talked a lot about respecting the privacy or respecting a person's need not to tell you too much, not to reveal too much. I think he taught a lot about respecting somebody's defenses and being very respectful for their need to be quiet and need to talk in their own time and reveal their history in their own time.
Sure.
So Dr. Spotnitz was a huge influence on your
Yes, he was.
On your life.
I must say he was a very big influence. I had different kinds of influences in other situations that didn't compare with what Hyman Spotnitz taught me.
And Marie studied. Marie studied with Hyman Spotnitz.
Yes,
Dr.
he did
Spotnitz
also.
too,
Marie became a patient of his very rapidly, and I also brought my children. I had 3 children, 2 girls and a boy, and I got them to come in and sit around with Marie and myself in his office, and he welcomed my bringing them in. And in addition, when the Macy Day Parade was coming down in front of his place, he recommended to me I bring my children in and watch the parade through his window so that my children could enjoy it better and didn't have to stand outside in the cold. And my children were able to talk very freely with him because he was the kind of person that they didn't need to be afraid of right from scratch. And they enjoyed that.
Very good. Well, thank you so much, Dr. Lucas. We're going to sign off now.
Okay, good.
And it's nice to hear the story of your life.
Okay.
And we'll be back. We'll return with more pieces of your life.
Oh.
Yeah.
Okay.
We'll have the opportunity
to.
Very good. Okay, so this is Mark Sehl signing off for Therapy for the Heart with this interview with Dr. Gerald Lucas and myself here today. Thank you very much.
Yes, thank you.
Bye.